As we continue to cover COVID-19, there are a lot of questions about antibodies in particular and the science behind this virus. So we have with us today principal scientist, Dr. Mary Rodgers of Abbott Labs, to talk a little bit more about that. Dr. Rodgers, thanks for joining me. I appreciate it.
Thanks so much. Good to be here.
First of all, can you tell me how do antibodies work? What are they?
So antibodies are part of your body's response to a virus. So when you're infected, you'll develop antibodies as a part of a way to control that infection, recover from the virus. This information is also important for doctors too, because as they manage patient care, it's important to know who's already had COVID-19, especially as we're starting to see some unexpected long-term effects that are having a emergence now as we see more people farther out from their recovery. So some people are experiencing strokes or some lung damage that is lasting longer and is even occurring in people who did not have symptoms in the first place.
I've read some studies that have shown that some of these antibody tests are only about 20% accurate. What do you say to that?
It's really frustrating to see tests that are available that aren't working very well. And accuracy has always been really important to us at Abbott. We've been making tests for diagnostics for infectious diseases for over 30 years. And so this is something that we take very seriously. Our test is performing really well. Our tests are showing in our hands and others with thousands of samples that our specificity is in the high 90s and the sensitivity is in the high 90s, which means that we have a very low rate of false positives or false negatives, and you can be very comfortable in knowing that those test results are accurate.
As a scientist, and as we continue to learn more about COVID-19, and as we reopen the economy and then close the economy back again, are we not just delaying the people that are going to be exposed to COVID-19?
It's really frustrating for all of us. I think we all really want to go back to normal, and it's hard to predict things in the long term because it's important to keep in mind that every virus is different and we don't really know what the agenda is going to be for this virus. What we have to do is take it one step at a time and make sure that we're following the guidelines that are put out in place for each individual region to stay healthy. And so that means protecting our kids, protecting our communities, and as hopefully we get closer and closer to some kind of normal again.
If I test positive for the COVID-19 antibody, does that mean I will not get COVID-19 again?
Still not clear on whether or not there's protection, but because we have this antibody test, we can now start to monitor people and know whether or not they're going to be protected. And it's really important to know that as more research is done, we'll start to be able to have those definitive answers. Already we're starting to see that some people probably are prevented from getting a new infection. And so as more and more people have a larger body of evidence, then we'll feel more confident in those kinds of answers about immunity.
Dr. Rodgers, we appreciate your insight today. Dr. Rodgers from Abbott Labs, thanks for joining me.
Thanks so much, Terry.
We'll have this full interview for you on KVUE.com. We're back after this.